In this range of motion testing, we're gonna be doing the supine hip external rotation. Now, in terms of just general movement and how this looks, a lot of people confuse external rotation and internal rotation. In this position here, this is going to be external rotation. A lot of people get confused going, I don't get it. This is internally rotating. What we're looking for here is the hip. So if I were to take my hands this way and do this motion, notice how the femur is externally rotating. So just a quick little tip for you guys, don't confuse this for internal rotation. This is actually external rotation. So let's go through just a few do's and don'ts. So we have our tape right through the middle of the patella. I've lined it up from the ASIS, top of the patella, and then from patella down to the middle of the ankle. This is going to be our measurement, our measuring line right here. In terms of restrictions and what could cause a restriction in external rotation, we have two muscles that are asterisks. We have our piriformis and our adductors. Now the reason, even though those are not internal external rotators, well the piriformis is, but when hip flexion, we get into this position here. So if I were to do this lying down and look at internal external rotation compared to hip flexion, those two muscles, the piriformis and the adductors, will actually restrict external rotation and play a role in this. Now the other muscles that we're looking at here in terms of restriction for external rotation are going to be your TFL, your glute min, but also the core. And I'm going to show you this in 1 second. The core can play a part in terms of some hip tightness. And if we do have a restriction here, there's something that we're going to do first to see whether it's core related or whether it's muscle related. So let's take a look now at just what is our optimal range of motion. And 40 to 50 degrees is our optimal range of motion. Now, depending on sport as well, I usually go closer to that 50-degree mark as opposed to that 40-degree mark. Keep in mind, we also do have people who are over or hypermobile, meaning that if they can get to a 90-degree mark, we have some hypermobility in the hips. So we're going to be comparing this to our internal rotation as well and making sure we have a good balance between internal and external rotation. So to set this up, we have knee directly over top of that hip joint. Foot's going to be out. We have our marker line right here. I'm going to kind of guide the tib fib right now and making sure that we don't have any of this or any of this while we go through that motion. So I'm going to secure the knee. We're going to go into external rotation. And that's about all we have right here. So do me a favor and hold that position. Again, using our marker line, we have a staggering 35 degrees. Now, if we, again, going back to our chart, we're looking for at least 40 to 50. We do have a restriction here. So the first thing that we're going to do is see whether or not we can improve range of motion by going through some core activation. Now, you might be wondering, what does core activation have to do with hip mobility? Proximal stability, meaning the stability through the core, will affect distal mobility, the mobility through the hips. And the reason why this happens is that a lot of people might think their core is activating because they do a lot of crunches or leg lifts, but in reality, the core does not activate properly without proper training. TVA, the obliques, all the proper core muscles have to work synergistically and together in order for the hips to do their job. So what starts to happen is the core doesn't function optimally. The core will not brace, meaning that the T-spine and everything above the core and the hips tighten up. So what we're going to do right now is a very simple plank activation. We'll do 3 reps, activate the core, and if the core is an issue, we will notice a huge increase in range of motion right away. If we don't see an increase in range of motion, then we can go back to our restrictions and look at things like the TFL, glute min, glute med, and also the piriformis and the adductors. So do me a favor and get into a plank position for me. So Sarah's going to get into a good plank position. We're going to activate, so I want you to draw that belly in. I want you to breathe out as hard as you can, squeeze, and draw your toes and your elbows together. 5 seconds. 1, 2, 3, 4, and relax. Take a deep breath in. Back up. squeeze. And what I'm doing here is I'm placing my hands along the side, making sure obliques, TVA are properly engaged and properly activated. Good, one more time. Back up. And squeeze as hard as you can. 5 seconds, 1, 2, harder, 3, 4, and relax. Back on your back, please. So we had a very suboptimal range of motion the first time. Let's see if this actually improves. Okay, so how's that feel? Now hold that position for me. So do you remember your number before? 35. Big 35 degrees. And now we have 50. Now, does that feel as restricted as before? No. So before we were kind of stuck in this position, and now I feel very little limitation. And so what we're trying to prove here, and the reason why this works so effectively is that as soon as this engage, and as soon as the brain knows, hey, my abs are back, they're working, they're doing what they're supposed to do, like a light switch, this will disengage. So before you start implementing a lot of the corrective modalities, the faster release and things like that, when it comes to a lot of the hip restrictions, always make sure to try the core activation first, retest and see if we've regained range of motion, so that way there in your corrective protocols, you will go through core training, proper core training, like the stuff that we've outlined first, to regain more mobility through the hips. Now, sometimes it's a combination of both. So if she went from 30 degrees to maybe 35, and we saw a little bit of an improvement, then I would definitely make sure to do both. But if all we did was 15 seconds of core activation and she went from 30 degrees to 50 degrees, the first thing that I'm going to put in my mind is proper core activation techniques, and she will notice an immediate difference in how her hips move and how she feels.